Hello, my name is Julie Cusick and I'm from Alberta Capital Airshed, the Communications and Outreach Coordinator. Welcome to our webinar on wildfire smokes, impacts on the environment and health, and what we can do about it. We're joined today by three incredible experts in the field. We have Alex Drummond in the area of forestry, Dr. Kevin McCullum, who will be talking about air quality data, and Dr. Ann Hicks, who will be talking about environmental health and in particular the impacts of wildfire smoke on children. With that, here's the more full introduction. Alex Drummond is a senior instructor at Norquest College, a former instructor at the UofA's forestry program, and the former president of the Canadian Institute of Forestry. Alex is here to help us better understand what happens when wildfires occur, as well as what we might expect going forward. So with that, Alex, I pass the mic on to you.
Thanks so much. Good afternoon, everybody. I'm just going to get this up and hopefully you can all see. Are you guys seeing that? Okay. Let's get started here. Okay, so I have a very short time to talk about a very complex subject, so I hope you'll bear with me, and if I skip huge things, feel free to call me on it, and we'll answer them in the chat. So, wildfire smoke and climate change, hotter, drier, and more and bigger fires equals more smoke, and some of the other panelists will be able to speak to some of those implications. So we'll go forward in there. Okay, so just a couple quick things to think about. Wildfires are natural. They're often caused in this part of the world by lightning, and they're caused by human beings in all kinds of ways. The big fire that called the Flat Top Fire that burnt parts of Slave Lake was from an ATV. Trains, railways, campfires. Even things like a Coke bottle left in the grass can magnify the sun and sunlight and start fires. So we have all kinds of ways that fires can start, particularly on the human side. The proportion of fires that are natural versus anthropogenic varies year to year, obviously, and it also varies on location. So a lot of it has to do with population density. More or less in Alberta, I mean, as I say, it varies. About 40% of our fires are anthropogenic and 60 are natural. Natural fires tend to be much, much larger. They tend to burn in remote areas that are harder to access. As an example, sort of at the other end of that spectrum, California, their fires are 80% anthropogenic, and it just makes sense because there are way more people. So, and there is a correlation between, the population density and the amount of wildfire based on human starts. An important thing to note is that fires are episodic. The intensity and severity of fires varies annually, but in terms of a trend analysis, our wildfires are burning more and more hectares, and it's big fires that are taking up the vast majority of that. So once a fire gets going, it's a lot harder to put out. There are three, or maybe some will argue four things that really control wildfires. Fuel, that's the material that's being burned. Weather, so hot and dry and windy is bad for fire spread. And then topography, fire moves up and down slopes differently. If we have a lot of relief, fires behave differently than if there's very little relief. The other one is starts, so how fires are started. I quickly went over that, but really the only thing in terms of the fire triangle, that's fuel, weather, and topography, we can control is fuel. And then perhaps on a sociological level, we may be able to control starts. So, but there will always be a minimum amount of natural wildfire. Okay, so we saw a big trend analysis for Alberta and BC. This graph is from a paper from 2008. You can see the reference there. So boreal forests, which are the vast majority of forests in Canada, are showing under climate change models, is showing the largest temperature increases. And you can see in the graph to the right that there are the A2 and B2 are two climate models. And then there's one observed, which was the 1991 to 2000 decadal data. That was the only one that was available when the paper was published. And you can see that under these two climate change scenarios, we have large increases in the amount of wildfire. So, and of course, we'll talk a bit about feedback loops, but one of the real things is with climate change and warming, we're going to see permafrost well, we actually have teeny bits of it in Alberta, but into the north of 60, permafrost melting, that's going to allow more fires in peat. Peat is an excellent carbon store, and if those start to burn, we're going to have a lot more carbon. So we see these nasty feedback loops that can cause us more difficulty. Okay, I'm not going to go a lot into smoke. You guys will hear lots about smoke, but smoke is a complex dynamic mix of gases and particles. And of course, when you think of air quality, the thing that wildfire smoke is bringing is particulate matter. Depending on the jurisdiction, we sometimes have trouble dealing with wildfire smoke in terms of our air quality indices. BC has some pretty cool ways of dealing with it with wildfire smoke, and I know there's some looking at it for Alberta. Unlike industrial emissions, the sulfur dioxide, NOx, and volatile organic compounds are not predictable. And all this varies depending on the type of fuel. And in wildfires, structures are also burned, but they're, in this part of the world, they're not a huge problem, and we protect human infrastructure quite aggressively in this part of the world. The fire intensity, so how hot is it? What are the thermal units being released? How far that smoke is from the fire, and how old that smoke is. As a very broad generalization, the smoke particles tend to be smaller at greater distance from the fire, and with time, they're just bashing into each other and just falling to pieces. So close to a fire, you get firebrands, like branches being thrown. 100 kilometers away, you've got much smaller particulate matter. So where are we with wildfire? Well, we see an increasing trend, and it's sometimes challenging to look at the future because it is a bit of crystal ball gazing. But Mike Flanagan, who's a world-renowned wildfire researcher and meteorologist that looks at climate change a lot, his quote is, "There's a lot more fire in the future, and we better get used to it." So the consequences of fire we should be thinking about as well. Spread. So climate change has impacts on weather, and then we move from there. Eastern Canada could see even a more dramatic increase in this kind of fire weather. So other studies predict that fires could burn twice as much average area per year in Canada by the end of the century and has burned in the recent past. Climate change will likely bring more blocking highs. It's essentially weather systems that will stall in place and bring us fire, challenging fire weather conditions. These are all predicted. And then something we generally don't think about is NRCan estimates the fire protection costs could double in Canada by 2040. That's less than 20 years as we attempt to keep up with this worsening risk. So just as a note, so when I was really active in fires in the early 2000s, so in 2001, it was $72 million just to turn the lights on for a fire season. And then, on a big fire, you can be spending well over $1 million to $2 million a day on fire suppression efforts. So, and that doesn't even include things like evacuations and some of the other costs associated with that. Loss of economic value from a community that's evacuated is important. And then sort of impacts on other industries. We have a lot of oil and gas infrastructure out there in the landscape in Alberta. Those things have to be shut down quickly, costing a lot of money and then a lot of potential revenue. So there's big problems there. So, you know, and probably in a bad fire year in Canada, our resources across the country are stretched. We have really excellent mutual aid agreements, but we've been bringing in wildfire team members from around the world, South Africa, Australia, New Zealand, Mexico, and that's likely to increase, and other jurisdictions will also have similar challenges with resources. So expected shifts in wildland fire patterns. This is the Government of Canada brought together a whole bunch of data and research work. More frequent fires in many boreal forests with severe environmental and economic consequences, likely to have alteration in patterns of lightning, fuel moisture, temperature, precipitation, and vegetation, all factors that increase or affect fire occurrence. Fire-prone conditions are predicted to increase, doubling by the amount of area burned. And then other climate change impacts could add damage or dead wood to the forest fuel load, insect outbreak, ice storms, or high winds, and may increase the risk of fire activity. Just a quick note, in our forests in the boreal in Western Canada, we actually have an artificial age class structure. We've been very successful in eliminating wildfire from our landscapes, and because of that, our forests want and need to burn. They haven't. We actually have probably more fuel loading now than we would under a, you know, in quotation marks, a natural fire regime. So we run the risk of big fires, of course. New research is aimed at refining these climate change estimates of fire activity, investigating adaptation strategies and options, but we're gonna see more stress on our infrastructure as we go. Relative to this discussion, this slide is an attempt to graph out a very complex feedback systems in a very sort of hopefully understandable way. The highlighted area under the red is essentially what we're talking about today. We're going to have more wildfires, we're going to have more air pollution, and as a consequence, mortality and morbidity. Just a quick note, the graph here is from NOAA in the States, and it shows temperature anomalies. Red is hotter, obviously, and the bigger the circle is, the larger the anomaly. You can see by looking at this that clearly the northern biomes, particularly the boreal forest across Northern Europe and Russia, Siberia and North America, show that warming quite simply there. We're under a climate change model where more polar ecosystems are affected more severely. So just remember fire and temperature. I won't go through the points in detail here, but temperature has a strong positive correlation with lightning. The warmer it is, the more lightning we're like to have. That's going to give us fire starts in more remote locations, and we're going to have, you know, predictably more starts and larger fires due to fire weather. So what is the future? Direct, indirect, and interactive effects of weather and climate, fuels, and people will determine future fire activity. The experts agree that we're going to see increases in all these areas: area burn, fire occurrence, the length of the fire season, the intensity of the fire, and the severity of the fire. So not a very enthusiastic future or positive future in terms of wildfire. You know, and then there's subsequent costs to this, as we'll discuss later through the seminar. But just to end it off pretty quickly, can we prepare for this from a forest management perspective? And the answer is possibly, but I would posit probably unlikely. The things we would need to do are, in terms of the policy environment, would be extremely difficult, and in terms of social acceptance would probably be not that great. It means sort of landscape level alterations of forest cover, which, you know, as we've seen in various places around the world is never really seen as acceptable. So what we can do, but unlikely will do, is we can fireproof our forests. And what I mean by that is you can remove the more combustible fuels and replace them with less combustible fuels. So as an example, in Alberta, you can remove conifer forests and replace them with aspen forests, which are a wetter fuel and will push fire to the ground where it's more easily managed. That would mean very large areas of forest conversion. It's technically doable, probably not in terms of a policy environment, because we have obligations through forest management agreements to keep mills and communities going through those industrial activities. You could do some silviculture activities. Silviculture is the growth and harvest of forests, essentially a la agriculture. You could do some things there. Again, it would involve sort of wetting up the forest and putting in different species. Certainly possible over a long time period to do that. And you can do prescription burning. Very challenging to do, and can be seen as very negative. As an example, the mountain national parks have been doing prescribed burning, but there is a great deal of resistance from chambers of commerce, for example, because it affects tourism. And then finally, we might be able to manage fire starts. But again, as I implied earlier, this is a big societal issue. You could ban, over time, you could ban ATV use. You could have area closures. You could have a lot of things that would impact people's use of forests, but are certainly doable, and there are examples of it. So a couple things here, some references, they'll be available for you. The one at the top is a series of programs. It's a podcast that Mike Flanagan, who I mentioned earlier in the presentation, did with CBC. So he was the co-host. It goes through, I think it's 6 episodes. Each one's about an hour long. If you're on a long road trip, it's a really excellent, very well done, very reputable, and I'd really recommend World on Fire. It goes through the McMurray fire, the BC fires, and the consequences of that. So anyways, and then there's a couple. This carbon brief is written for the layperson, how climate change is affecting wildfires around the world. So you can see this isn't just a Northern Canada problem or a Siberian problem. It's we have burning all over the place. You may recall the wetlands that were burning in Southeast Asia the last couple of years. And then there's this is the last one, is it's a fairly old paper, relatively speaking, but it goes through a lot of the things in a relatively simple language. So that's what I wanted to talk about. Yeah, happy to move forward and look forward to answering questions and having a discussion.
Thank you, Alex. So what we'll do now is we'll move on to our next panelist, who will take everything that we just learned from Alex and then talk about the air quality piece of it. So with that, let's welcome Dr. Kevin McCullum to start sharing his screen. Kevin is the data manager and chief scientist with Alberta Capital Airshed. And one thing Kevin is really great at doing is making data seem really fun. So go ahead, Kevin.
Perfect. Can you see the screen okay? Is it sharing okay?
Looks good.
Okay. I'll jump right into the presentation because like Alex was saying, I probably have about 30 slides, so I'm going to try and get through this as quick as possible. What I'm going to talk about is some of the emission profiles that we see and some of the data that we're picking up. So I'm just showing a quick snapshot of the 2020 carbon emissions. So that's one of the sources that we look at. Wildfires can emit between about 5 to 30 tons of carbon per hectare burned. And as Alex identified, we're mostly concerned on the NOx, the VOCs, so the nitrogen species, the volatile organic compounds, the carbon emissions, and of course the particulate matter from the smoke. So we're going to focus more on the smoke side of things just as we move forward. So just a quick snapshot overlaying a lot of the 1917 to 2019 fires onto a map. One of the things that we'll start to focus in on is just the sources that we see just really in that last decade. 2018, we had several exceedances of PM 2.5, our guideline that we look at. And this is just the counts that we're looking at from that exceedances. 2020 was not as bad of a year, but we've already surpassed 2020 with our exceedances of PM 2.5 going forward. So as we said, it's kind of, it looked like it was getting a little bit better, but then it did a turn on us. So I'm not going to explain the full graph here because there's a lot of information buried on here, but what we looked at is all of the provincial monitoring for PM 2.5. So this is all the stations in Alberta that collect PM 2.5 over those decade time frame. And I just highlighted at the bottom when we had really extreme events or really high readings, our maximums. And what I looked at was readings that were greater than 800 micrograms per cubic meter. So that's 10 times above our guideline limit. And we had 19 periods in which that had happened. And this is an extreme reading because most of the times we will not see readings quite that high. At that point, with 19 of these 1 hour periods, 2016 and 2019 actually had 14 of those, where the other 5 events were in 2010, 12, and 15. But it was the 2 events primarily in 2016 and 2019 that we'll talk more about. When we look at some of the events, even in just looking at the last couple of years, 2018 was, of course, one of our worst fire years that we had. Nationally, we had over 2 million hectares burned. In Alberta, there was about 60,000 hectares. And then during this time frame, we recorded almost 4,000 1-hour readings above 80 micrograms per cubic meter. So to put that in perspective, those happen over a 1-hour period, and that has to be called into the government to alert that there has been an exceedance from the stations that are recording this. So this would have been alerted that almost 4,000 times for a 1-hour event and 730 times for 24-hour events. And that's when the average is above 29 micrograms per cubic meter. So there were several readings, obviously, we see in 2018. When we move to 2019, one of the things that we're seeing is that we had one of the worst fire years, of course, in Alberta. And during this time period, we saw almost 1,000 1-hour readings above that 80 microgram limit and about 250 above the 24. So these, again, are all numbers that are going to be called in. To put it in perspective, in 2020, we actually had 47 1-hour readings above 80 micrograms per cubic meter. So between the 2018 and 2019 years, when we're in the 1,000 range, and then into 2020, we're at 50. So it makes a much different picture for sure when we look at the data from 2020. When we look at the wildfire just events and what we were seeing throughout Alberta, one of the things that we focus in on is 3 of the main events. So the Slave Lake fire, Alex had identified that one, the 2011 event, our Fort McMurray fire that happened in 2016, and then the 2019 smoke event that happened in Edmonton that I'm sure most people remember that event. So just to put a snapshot on, we see this was the event, and these are all of the stations combined into a 1-week period. So I buried 50 stations that monitor PM 2.5 into one graph. And what we were looking for is when we had these high events or these high peaks that were occurring. And all of these peaks were occurring in UofA stations. So Fort Chip, Fort McKay, Fort McKay South, Fort McMurray, stations like the Athabasca Valley, Patricia McGinnis stations, all picked up the smoke because as it was moving from Slave Lake across over to Wood Buffalo, that's where we were seeing all of these events. There was no way to look at this one from a satellite perspective because of there was all cloud cover at the time to see from these periods. But when we look at some of the other events, so this is the 2016 Fort McMurray fires, we can actually see some of the fire event. So we see the fires that happened in that time period in McMurray. And we also see from the stations what was happening when we were seeing these elevated readings. So one of the things that we can start to look at is now we can see this on a daily basis for the satellite photos to start to track it. And we also correlate it back to some of our stations where we're picking up some of these readings. And the way the data is now moving with the real-time satellite is that we're starting to look at it, at least from this time period, we were able to go in 2016 in the morning and afternoon, so AM and PM effect. Now the data is coming in hourly, so we are starting to look at it more frequently from that perspective. So it gives us an appreciation to start to look at this and events as we see them moving forward. If we look again, this is the following week in the 2016 timeframe for the Fort McMurray fire. We saw that it clears off a bit, so it's either when the winds will pick up and it will dilute some of the smoke, or it shifts from the station, because the station is fixed when it's monitoring and picking up the data. So it's not able to move, but rather the smoke moves around the station. So if the smoke is able to cloud or come into contact with the station, that's when we're going to see the spike event happen. And that's what we tended to see. So during these time periods, we saw further spikes occurring into those high elevated readings. And of course, then it's a fumigation type effect that we see on the stations and with the surrounding environment. In this period, we're looking at now the fumigation event or the smoke event that happened in 2019. So this is what happened in Edmonton. This is the week just before, where we had the fires up in the northwest, and the smoke was moving across towards the east. So I put a little snapshot there of the provincial network where we saw the heat indication for PM 2.5 highlighting on the Wood Buffalo station. So it wasn't nearly as high when the smoke was close to the stations, but rather we see that it was just highest in the province in that time frame. The very next week, as this was moving in, we saw this happening. And so we see that fumigation happening into the city. We see the smoke coming in. And this is where we now saw the readings spike. This week time period that we're looking at from all of the stations again, we saw huge increases and into numbers that were actually quite elevated and well beyond some of the levels that we've seen in some time. So in this case, we're looking at the hotspot was the Edmonton region or the ACA region, and we saw all of the stations within that area all show quite elevated readings for PM 2.5. Just to put that in perspective, one of the things that we looked at in here was that we looked at some of the data, just a snapshot of the 2019 and 2020 data sets. And the big one that we see is the 1 hour readings that are above 80 micrograms per cubic meter. So in the ACA region, we look at all of the elevated 1 hour guidelines that were exceeded. And then we look at it in 2020 where we see a substantial difference. We saw one as we move forward into 2020 in the region. If we look at the 24-hour data, it was about half. So you're looking at about 33 that occurred in 2019 and about 20 that occurred in the 2020 timeframe. So there's a much bigger difference as we move forward, not precluding some of the information. As we know, things could change. And in 2021, we've already seen some elevated readings that are above our 2020 numbers as we move forward. So I flipped through that pretty quickly, so I'm hoping that I didn't lose too many folks on this one. But I did want to include some of the references for some of the data as we go forward. So some of these are the references from the data sources where we can get them. And then some of the data or some of the information as well is the things like the smoke forecast. So this is the one that's going to be able to give us the forecast of when we see the smoke events happening in the next 24 hours. And you can actually start to look and see when things are moving forward. So if we look at the current smoke forecast profile, we would actually just get where the hot spots are. And then if we zoom in into our region, we'll see if there's any potential fires coming through or smoke coming through. The other ones, of course, is the live satellite feed or the data that's probably within the hour or a couple hours that we move forward. And then the one that always looks neat, so that we can look at our data real time and which way the winds are blowing and which way things are moving on us on the planet. So I always like to show this one just for the ooh effect, because it's always a neat one to see. And so, all fast? Was that fast enough?
That was great. Thanks, Kevin.
Perfect.
Wonderful. One of the things we're trying to do today is give short, sweet presentations to leave lots of time for conversation. And yes, thank you. That was great. And just a reminder to everyone, we will be sharing the presentations as well as all of these links that our panelists have been sharing with us. Those will be emailed out to all participants as well as shared on our website. All right, that brings us to our final panelist of the day, Dr. Ann Hicks. Ann is the clinical lead at the Children's Environmental Health Clinic at the University of Alberta, and she will be presenting on how wildfire smoke impacts children, as well as some things we can be doing about that. So with that, Ann, I will pass the mic over to you.
Hi, and thanks so much. Sorry, I'll just start my slides here. Does the screen show okay?
Looks great, thanks.
Perfect. Yeah, thanks for inviting me. I love talking about health impacts on children. I'm a pediatric respirologist, so that's what we think about. I don't have cool pictures, but we'll try and make up for it with bright colors or something, being pediatrics. And what I'm really hoping you'll be able to take home from this is, first of all, being able to describe kind of the impact that wildfire has on children's health and development, and then using kind of a practical approach to think about those problem-solving things that we have to do when kids are exposed to smoke to help prevent respiratory problems. And most importantly, I think, when we're planning or advocating for managing or prevention of wildfire events, including child health, because it's unique and important. Yeah, and in medicine we always use cases, and so none of these are real people. These are amalgams of a zillion patients. But this is kind of how we teach medical students, just because there's a lot of stuff to remember. And this was an important thing in Edmonton. There's this Fringe Festival every year where tons of tiny little venues, except for COVID, of course, have plays. And they do play after play after play every day, and you buy your tickets online, line up outside, wait for the last audience to file out, and you file in. The year before we talked to this patient, they missed a ton of the plays that they'd paid for. And this is a big thing for this kid. This is something they do with their family every year, and it's a huge bonding experience. And the problem is 15 minutes outside on a smoke day means an asthma attack, going home, maybe going to the emergency room, not going to the show. So I want you to think about just like some of the things I talk about are kids getting sick, but a lot of the things that impact people are their quality of life. And as a grown-up, we get really disappointed when we can't do stuff. But as a kid, it impacts your life view to think, I'm a person who's never going to do this stuff. And why do we focus on children? Why don't we focus on other people that we know are really high risk, like the elderly? Kids are little. Little kids are really little. They have this huge surface area to body mass ratio, and their lungs the same thing, which means that per kilogram of person, they absorb way more toxins than you and I do as big people. Kids have a really fast metabolism. Babies breathe 40 times a minute for a healthy sleeping newborn, and their heart beats 120, 140 times a minute. That is very, very fast. So they're taking in a lot more stuff, and they're developing, which means that if you or I were going to get sick and get better, they're taking a hit that could send them down the wrong path, for instance, into allergy and asthma, when it might not have had to have happened if they didn't take that hit. And so we always think about their growing and changing bodies. As anyone who's had a child knows, trying to keep their hands and mouths out of everything is almost impossible, which means the particulate matter from wildfire smoke gets on the ground or onto them, and it gets into them very rapidly. And they're really active. Kids go outside, they play, they don't necessarily regulate their behaviors depending on the exposures. As well as that, in little kids especially, the liver and kidney function a little bit differently. So those are our body's big detoxifiers, but the enzymes that are active in them are a little bit less active. So again, already we've put more toxin into them because of their surface area to body mass ratio and their metabolism. Now we can't get it out again. And on top of that, they live for a really long time. That's our goal for all of our kids, which means that they have a really long time to develop secondary effects from their exposures. So what are some of those effects? And I wanted to talk about a couple of areas in particular. So one of my colleagues, Dr. Maria Ospina at the university, just completed and published a systematic review and meta-analysis on the impact of wildfire smoke exposure on pregnancy outcomes. And she showed a significant difference in the number of preterm births and the number of small for gestational age infants. Maybe you're born at term, but you're littler than we expect you to be. And those are both outcomes that actually potentially have lifelong consequences. So this is a picture of a baby that's born about 3 months early. It's just a random picture, but not any particular baby. But it's fairly typical of what you would see. So they're around 500 to 700 grams, and they have lifelong complications. So about 20% of children born at this gestational age are not going to make it. And about 80% of them are going to have some kind of lifetime impact, whether it's just a little bit of vision impairment needing glasses, or whether it's life-altering cerebral palsy. Something is going to happen. So if we can prevent that, and 1 in 10 babies in Canada is born premature, not all this premature, but every single one of them is going to have some kind of lifetime consequence. So that's really important. I'm just completing a systematic review with a student looking at emergency room visits and hospitalizations in children who are exposed acutely to wildfire smoke. And there's a significant increase in both of those things, which makes a certain amount of sense. But when you think that some people are evacuating or staying indoors, you are still seeing those increases. This picture of this little girl is not a person who was specifically impacted by wildfire smoke, but she's incredibly important person on a global scale. She had severe asthma, and she had many ICU admissions and hospital admissions secondary to exposure to air pollution. She passed away at the age of 9 after an air pollution exposure led to a fatal asthma attack. Her parents fought for a long time to have her death certificate read air pollution as cause of death instead of respiratory failure. And because of her, and because of her parents' actions, people are working on improving air quality where she lived and in other places. So she stands as a representative of what we need to do to improve lives for children with respect to wildfire smoke. And there's long-term impacts too. I addressed a little bit the mental health, but when we look at other kids, one of my patients from Fort McMurray, when he was about 4 in 2017, we were talking about his new home, and he said, "When's this one going to burn down?" And you know, the expectation in that child's mind is there's going to be impacts from wildfires on my life forever. And it was just part of his life that your house burns down on a regular basis, which isn't something that my kids ever think about. And that brings me to another patient scenario where we're looking this time at a 4-year-old with kind of moderately severe asthma, so not even terrible asthma, but is frequently sent home from daycare because of cough and respiratory symptoms. And missing about 30 days a year. Most of the times that this has happened are not because of a viral infection, which is pretty typical, but because of outdoor play on poor air quality days. And a lot of those days were smoke days associated with years where there were more wildfires. In daycare, if any of you have little kids in daycare, there's head count rules. So you can only have a certain number of children per caregiver, which means if everyone goes outside to play, this kid is going outside to play too. They can't stay indoors, which means they get an exposure, have an asthma attack. They feel terrible like 10% of their life, and that's not okay. So again, how are we going to solve this problem? You know what? Before we get to a point where we stop wildfires and don't have smoke. So I wanted to make you think about vulnerable populations. Who is at risk? For sure, we know the elderly, those with cardiorespiratory disease. Children and pregnant women are at high risk from impacts of wildfire smoke. People with immune deficiencies and other problems that could lead their lungs to have an abnormal response. People who work or play outdoors, and people of low socioeconomic status or marginalized communities are at very high risk from being harmed by wildfire smoke. So what do I tell patients? Because, you know, it's not like I can deal with the wildfire smoke. I'm not good at those things. Those are for other experts. Well, my patients need to avoid being outdoors, and they need to keep the smoke outside, which means if you don't have air conditioning or something, it can be really unpleasant in your home. And I have one little girl in my clinic whose family members, cousins and things take turns coming and playing with her when it's smoky outside so that she's not lonesome because she spends her time inside. She actually started something in our complex asthma clinic when COVID lockdowns started, where she and the other kids who have really bad asthma wrote letters of advice to children who have normal lung function, telling them how to cope with being locked away. How do you deal with lockdown? Well, I know I've got great strategies because that's my life. We help our kids stay in control, so adhere to treatment, same as COVID actually. You want your lung problem to be in good control, so lots of medication, lots of free samples that we beg and borrow from drug representatives for patients who don't have coverage. And you can't do trigger activities, so yeah, no more marathon running outside, but also things like don't visit grandma and grandpa because they have a cat you're allergic to and they smoke, and usually you can handle it with some extra antihistamine, but not when it's smoky outside. And we got to treat them. So if children are struggling to breathe, if a newborn baby is wheezing, get them to the hospital, get therapy before they're in the ICU. So those are important things. The AQHI is one of my best friends. You can do a screen grab here and put it on your phone. My phone has it. It automatically sends you a push notification at 7, which is when most healthy people should stop exercising outdoors. I have mine at 4 because that's when we start to get sick calls, and all of my patients set theirs to trigger and let them know when they should stop exercising outdoors. So it's a fantastic tool to help patients manage their lung disease with wildfire smoke. So what did my kids do? Well, this first guy had a great solution. Dad called the organizers and said, hey, is there somewhere we could just wait inside? And they were like, yeah, totally. And so the fringe worked. What about the little one? Well, we did some education with the daycare. We brought one of the little AQHI circle things where you can predict what's going on and make a recommendation. Infants and very small children are not supposed to be outside at the same AQHI that triggers my patient. And so they changed practice at the daycare, and kids stayed indoors when they should stay indoors, which people didn't even know about. And that patient is allowed to stay inside now and help with the babies, and a front desk person comes to make the head counts fit. So way less missed daycare. So with a little bit of education, using tools that are readily available, we can make outcomes better for people. I'm not going to focus on this too much because this is not an area of expertise. I'm just like, yeah, close the windows, guys. But I don't really know anything about how to manage an air conditioner. But you need to stay inside if the air is poor outside because of smoke. Schools need to do the same thing. They need to cancel outdoor recess or at least have indoor options for people who are at risk of damage from smoke exposure. And air quality management in the school is very important in these situations because a lot of the regulations on air turnover can mean that you concentrate smoke indoors, which is the opposite of what you're hoping for. We need to cancel outdoor sports, and we need to make it safe for teams to say, I don't want to play my kids. Soccer Canada doesn't run competition past AQHI 7, and that allows coaches to protect their children without losing the opportunity to go to playoffs. And we need to find safe indoor activities for people, and we need to make it affordable for people of low SES and people who are marginalized. What about COVID? COVID is a nightmare for wildfire smoke protection because what are you supposed to do with COVID, the aerosol-borne disease? You increase your flow of outdoor air. You increase the total airflow in your building. You increase your air supply and your ventilation so that you're doing less recycling, and you open all the windows, right? So now we have a lot of smoke. Now what are we going to do? I have no idea what we're supposed to do. The only thing where COVID and wildfire prevention, smoke prevention, go hand in hand is increasing your filtration. So I guess we're going to have to filter a lot. But that's up to a lot of people, again, that are technically a lot smarter than I am. So kind of a summary of what we think about for children and wildfire. It's a big impact, and advocacy is going to be really important here. We need to change how things run for people in order to protect children in the long term. Climate change and wildfire management, again, out of my hands, but definitely something that we need to be involved in trying to work on. What else do you do? Well, I tell them to avoid exposure, and I'm going to be looking for vulnerable populations. Again, you know, put the AQHI on your phone, do whatever it is you need to do to protect people who are vulnerable. And how do we do that? That's advocacy that I do all the time. We're building social supports. We're advocating for safe housing for people. We're trying to improve schools and public buildings, and we need to understand what people really need to be healthy. Sometimes it's being able to go out and do something entertaining, because that's an important part of our lives too, especially if it's limited every single year. And we need to prevent and treat lung disease, and that's the only thing that I'm actually really what I do. But as a team, we all do these things together. So this is a picture of a beautiful river valley with an uphill view into the trees across the valley in Edmonton on a wildfire day. So this is kind of, you know, what we deal with, as you all know. I have a couple of resources here. The Children's Environmental Health Clinic is the only one in Canada, although we're developing a sister site in London. Anybody can be referred by any physician, and we do a full 2-hour environmental assessment for families to try and help them with the prevention aspect. The pediatric environmental health specialty units were developed by the Environmental Protection Agency in the US. They have amazing handouts for people and for clinicians, and tons of great resources. The World Health Organization and the CDC are other groups that can be helpful. And that's it for me. Thanks very much.
Wonderful. Thank you, Anne. And thank you to all of our panelists for really building this conversation. So just to summarize what I think I heard was, you know, in Alex's presentation, you know, wildfires are just going to keep happening, and here's why. And then we have Kevin saying, and here are the air quality data points and how that's changing things. And, you know, Anne's presentation saying, okay, this is happening. How do we deal with that at an individual or an organization level? So with that, we did get one question in the chat. It's from Diana, who asks, are there trees that can be planted in cities to help with climate adaptation and reducing fire risk? So I think for that one, can I pass it over to you, Alex, as our forestry rep to take the first stab?
Sure. I'm not an urban forester or a plant physiologist, but I mean, in terms of reducing wildfire risk, one of the things you can do, of course, is plant broadleaf trees. They're a wetter, you know, in terms of fuel, that they retain more moisture. They don't dry out as quickly as needle-leaf trees. So that would be one. In terms of climate adaptation, I mean, any species are good. I don't know if you look at horticultural species that we see in Edmonton, but we're seeing like Norway maples and even Ohio buckeyes. I mean, certainly they've been bred for colder climates, but for the different hardiness zones. But I mean, we couldn't have done that 15 years ago. Like, those trees would die here. We are getting warmer, and we are getting drier, so that's a problem for these broadleaf trees. But certainly there are trees, and as we get drier, I mean, there are things in Alberta that have been talked about. I mean, we've got ponderosa pine across the border in Montana, and just across the rocks in Crow's Nest Pass. I mean, ponderosa pine could be an important species here. The challenge with any pines, of course, is mountain pine beetle. You know, we're seeing trees dying, and of course that's going to release carbon, so we do have problems. But there you go. So that would be sort of my interpretation. Specifically for carbon, I'd suggest giving an arborist a call. They may be able to give better information than I can on that. So I hope that sort of answers the question.
Perfect, thanks. So another question is, Kevin, you had mentioned that in 2018 and 2019, we had quite a few exceedances, part of that because of those wildfire events. And then in 2020, we didn't have very many. I think you said only about 45. But in 2021, we're already seeing some exceedances. The other thing that was pretty unique in 2020 was the pandemic and a lot less people moving around. Do you think that, you know, that's having an interaction with some of this air quality piece, or, you know, is it mainly that wildfire piece? I don't know. Any comments there?
The one thing for sure is in 2020 we had not nearly as much burn, like acre wise or hectare wise, in comparison to the previous years. But even in 2021, for example, just west of the city, we have a peat fire going on. And so that peat fire out in the Tomahawk area, it's just all of a sudden it will flare up and we'll have an exceedance. And then it'll be quiet, like absolutely background readings, and then it will flare up and we'll get an exceedance again. So things like that, but that's a rather a unique situation with that type of fire. With respect to the burns, you wonder if people aren't out there, if as Alex was saying, like people starting fires, if we had less people actually camping or being out in there. I'm not 100% sure if that's part of it or plays into it, but.
Yeah, certainly last year there were way fewer recreationists out on the landscape. Industrial activities more or less kept going, and so, you know, as you drill down into the data, you can see that, yeah, there was many fewer recreation fires than there were from industrial. So, I mean, yeah, keeping people off there, but it's also important to remember that, you know, there are a whole bunch of other factors that influence fire starts. So weather and fuel, moisture and drought code, and like there's a fairly complex formulation to figure out your risk of fire. But certainly you can't sort of ignore the fact that there were way fewer people out there in the landscape. And I should mention too that one of the issues, Alberta is different than other places in Canada. So our big risk for wildfires is early in the fire seasons, whereas BC more or less is later in the fire season. So, you know, there's seasonality to this as well.
Perfect. I had another question for Anne, which is, you know, one thing that you talked about was advocacy, and certainly that's one of the pieces that this webinar wanted to get into was what can we do about it. So I just was going to invite you to offer any more advice or thoughts around that advocacy piece, and then maybe you know, Kevin or Alex, you could you know, jump in there after and maybe gives us a few more ideas, both from that individual perspective, that individual with an organization perspective, and then maybe that bigger system wide, you know, let's get governments involved type of advocacy.
Yeah, so I think some of that is limited at times, just depending on what we're trying to do. So certainly speaking to school, like one of the things that I do in my clinical role, but also that we can really train parents and children to do very effectively, is that interaction with schools and daycares and other places that children spend a lot of their time, and with sports teams who are maybe under a lot of pressure to push their team members to be physically active outdoors at times where it's really not safe, because otherwise if the other team is willing to show up and push it, then they get moved on to the next level, but your team has a loss. So there's things like that like my one patient that spoke out at daycare and said, hey, this is actually a little bit wrong and we can fix this. And it was a zero cost solution. So a lot of those things are great kind of community level or personal level advocacy moments. Even advocating for yourself, because respiratory disease is invisible. Or looking out for a neighbor who's pregnant and maybe helping them out with something that they need to get done outdoors, mow their lawn or something like that, so that they're not out there in the smoke. So tiny little things like that can actually change a life, right? Then some of the bigger pieces would be working with the Canadian Pediatric Society, the Canadian Thoracic Society, or the Lung Association, looking for places where you can do some advocacy work. And I have a team of undergraduate students that are putting together educational materials through them and through the World Health Organization and the Pan American Health Organization. So certainly if you're interested in doing a little bit more on the academic-y side, you can reach out to me, and I have little teams of medical students and undergraduates who are working in this area to really bring child health and exposure to the environment and wildfires to the forefront. So there's lots of different areas that you can attack it, and I would say for a lot of people it's going to be where's your expertise and where's your interest and what is your actual personal standing in the community that would help you step forward to the school board or to others.
Great. Kevin or Alex, did you have any points around the advocacy piece?
Well, yeah, I mean, there's certainly opportunities for advocacy. One of the things that that some of you may have heard of is the Fire Smart initiative. That's it's now an international program to look at protecting communities from wildfire. It's not so much a smoke-related thing, though there are those benefits, but protecting communities from wildfire through appropriate fuel management is something that there is a lot of advocacy around that. The larger problems, the larger issues, sort of landscape issues that I talked about, there tends not to be much advocacy. So in terms of fireproofing a forest, it may be too big a problem. Some of the stuff, like a lot of the good work around smoke has been done in British Columbia. They've had some issues, and Prince George is certainly an interesting community to look at in terms of smoke refuges and those kind of things. And so
I was just going to say that some of the other is being aware of what's going on. So Dr. Hicks had it perfect with your AQHI to your phone or to your computer for alerts, the email alerts, things like that just keep it aware. I know there's a bigger push as well with the federal government to get more microsensors into areas as well. So something like the purple air that's been really popularized on the West Coast, but something like that being spread throughout the region. So it gives us a better indication of when we start to see high smoke periods, and we start to be able to pick those off as well.
Perfect. Yeah, and I'll even speak to those purple airs. I just found out about those about a year ago, and they're super cool. You can go on the website at any time, go look at what's happening with the PM 2.5 around you. I know we've got one in my neighborhood, and when a neighbor has a campfire in their backyard, you can actually see the levels change and go back down. So it's really quite interesting. Now we do have a couple more questions here. Here's one from Peter to Dr. Hicks. How could low birth weight babies be more? So I guess it's a question around carbon monoxide and PM 2.5 and premature babies. Did you just want to take a stab at that, Dr. Hicks?
Sure, yeah. So absolutely we know that smoking cigarettes or smoking tobacco increases the risk of preterm birth and low birth weight babies. There's multiple impacts. Yeah, there's definitely the carbon monoxide and the change of blood flow to the fetus. We think there's potentially a nicotine effect because it certainly is a teratogen. And there's also other impacts from smoking that There's disruptions to the blood flow, and smoking cigarettes can cause some vasoconstriction, so like your blood vessels tighten up and you decrease blood flow to the placenta. And a lot of the birth defects that are associated with smoking are associated with gaps in blood flow. It's the same kind of thing you would see with cocaine use or with circulatory problems, where you have limb defects and things like that, and some congenital heart defects that increase. So I think it's really multifactorial, but totally agree that there's definitely a component of possibly carbon monoxide. There's changes to lung function in adult children of smokers even. So you can see like it's very long lasting. Some of the systematic review that I was talking about, they only included papers that had adjusted for confounders, including things like smoking rates. And in the child one that we're looking at as well, not all of the papers did, but certainly there's been some cohort studies that took advantage of the existing cohorts to look at wildfire response. And those are definitely adjusted for smoking rates. So I think that there's independent impacts of the wildfire exposure, as well as potential carbon monoxide, which I'm not sure how much of that you would get just from the wildfire smoke exposure. Yeah, I don't know if that's helpful.
Good, thank you. I'm gonna, I think, put you back on this spot. And again, we have another question on the health side. But of course, Alex or Kevin, please jump in afterwards from your own experience as well. And the question is about masks. Are there any type of masks that you would recommend on poor air quality days? So for example, the ones that we're already using for COVID, should we be using, KN95 masks? Go ahead.
Oh, yikes. Yeah, so actually the CDC website addresses that question. So yay. But yeah, the short answer is you could wear an N95 or like one of those big, with gas mask kind of things on it, masks, and you could filter out particulate matter. Our typical medical, like this guy, is not going to be all that helpful. Like it may take out some of the big particles that you would get up your nose and stuff, but the particles that we actually, so PM10 around 10 microns will land in your pharynx and throat, just because of the way air particles flow. It has to be 2.5 microns or smaller to get down into the alveoli of your lungs. And so that part of the smoke, and that's why we look at that when we're looking at health effects, is not filterable by this thingamajig. And like you can see when I put it on, even when I'm using it appropriately and fairly safe, there's going to be some leak around the sides and things like that. And unfortunately, I don't have an N95 in my office for comparison purposes. But when you put an N95 mask on, your face gets smunched and you actually suck in and out. It moves a lot with the air. So then you'd expect a little bit better protection. And that's why we wear N95 when there's consideration of COVID, as well as these beautiful objects to help protect us from that perspective. And I'm using COVID as an example because it's the right size to get down into your lungs that way. PM 0.1 and smaller can actually be absorbed directly into your bloodstream and doesn't get filtered by the lungs. And that is also a component of wildfire smoke that you would have to take into consideration. I don't know if that helps. Like going outside with a mask on, I wouldn't consider it necessarily protective. And although it's not terrible to breathe through an N95 mask, I wouldn't want to be jogging with it so much, because after a while it just gets really old wearing those, and they to have it fitting appropriately really digs into your face.
Yeah, but I'm no expert at all in this area, but I did attend a session where we talked about wildfire smoke, and one of the experts that did speak about it said, I mean, really with wildfire smoke, what you should be wearing is a respirator if you really want to, and I don't think that's a practical way forward. So even N95 masks are allowing particulate matter deep into the lungs that where we'll see potential long-term impacts.
Well, it sounds to me like, you know, I'm thinking of the slide on your presentation, and that had the COVID, you know, symbol with all of the air, I don't know, factors around it, and the only one that matched up with the wildfire smoke was the filtration piece. It sounds like that's one that is potentially an area that, you know, perhaps Alberta Capital Airshed could look into more in terms of how can people be protecting themselves, and maybe get some more information out on that filtration piece, so that our homes are helping to protect us.
I think that's enormous. And especially, you know, hoping to send kids back to school safely with COVID, it's going to be enormous.
Perfect. And so with that, I'm not seeing any more new questions, and we did want to wrap this up by 2:45. So what I'll do is I'll invite each of our panelists to sort of wrap up give us one more thought of the day if you'd like, and then we will close off this webinar. So we'll go in the same order that you presented. So Alex, you're up first.
Sure. Thanks. And thanks everybody for hanging in there. I guess my message is things are not going to get better in terms of wildfire smoke. They're going to get worse, because it's very, very reasonable to assume that we will be seeing more wildfire activity on the landscape in a fuel-loaded and warmer, drier, and more susceptible forest. So.
Great, thanks. Kevin, on to you.
Just again, thanks everyone for attending, and it was great presenting with these two experts. So the one thing that I'd probably add in is make sure you check the sites. Like if you want to go out and do some strenuous exercise, make sure your AQHI, what level you're at, and really just stay in front of it to see what's happening. There's lots of forecast tools out there that gives us the ability to see what's happening, at least in the coming hours. So just to be aware of it.
Thanks, Kevin. And Anne, last word to you.
So I think I'd like to echo what Alex and Kevin said, and I think even a little bit further into that, I'd say, you know, wildfires are like COVID. They came, they're here to stay. And so a lot of it's around our adaptations, and I think that we're ingenious, and you know, all of you out there can help with the filtration, with the other things, and we can all be advocates in our own ways in keeping people healthy, no matter what the challenges that we face are.
Wonderful, thank you. So what I've done, everyone, is I've put into a chat a little evaluation of this webinar. Alberta Capital Airshed is aiming to do more webinars around air quality, and we welcome your feedback. I do want to say or remind everyone that I will be sending an email out with all of these presentations and the links that our panelists did provide. And again, to say thank you to Alex, Kevin, and Anne for sharing your time and your expertise with us today, and to Russ for being there in the background to help make sure Zoom was working as we were expecting it to. So with that, thank you everyone, and have a good rest of your afternoon.